Welcome to Be Empowered, the podcast. This is where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered and apologetic, and always with a dose of empowerment. We're here to amplify voices, both yours and ours, and challenge the status quo and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
And I'm Dr. Shala Mokbel.
And today we're going to be talking about the toxicity in medicine. So I laugh because I often don't know whether we laugh to get through this or we cry together.
I know,
but
exactly.
This is such a big topic, and it's a very important topic. This is a topic that we will cover over a few episodes because I think it needs it. I think this is very important because toxicity isn't just one thing, right? We're talking about long hours of work, micromanagement, workplace harassment. We're talking about starting from pre-med, actually. We're in this toxic work culture. And then we go into med school, training. Oh gosh, training in and itself is toxicity, I think, embodied. And then you're told as you get past training and you become an attending, things get better. But as Shala and I both know, and you probably know, that's not always the case. So we'll talk about all those things and talk about what else we can do about it. And this topic particularly is important because I think burnout and mental health are crucial to what currently is happening in the healthcare system. It impacts the physician, it impacts patient care, and overall impacts career satisfaction.
That's
so,
right. Kind of Googled a little bit about this because some of the situations are laughable, right? Some of the stories are laughable. Unfortunately, it's sad, but it's true. It's like, really, are we kids? Why are we being treated like that? Or why medical students or residents or fellows and even physician attendings are being treated like that? So that's the laugh, that comes out of it. But at the same time, it's very sad and unfortunate.
Exactly. We laugh because we can't cry. And sometimes we cry too. I cried a lot in my medical training. Some days I still do. But that's why it's important to have these conversations. So according to a Medscape survey in 2023, 53% of physicians reported burnout. What do you think about that number, Shala? Do you think it's underreported?
It is definitely underreported. And we will talk about why, that culture of not speaking up. Not all physicians are open about this subject and they don't want to admit it. So that's why I think it's underreported for sure.
Oh, yeah. And there's a lot of stigma around that too. If you start saying things and they'll say, well, you're complaining, stop complaining, put your head down and work, because the culture is, this is how it's always been. Back when I was a med student, back when I was a fellow, back when I was a resident, how many times have we heard that? So I agree. I think that's why it's underreported. And actually, 1 in 3 female physicians in a recent study experiences gender-based discrimination. We did a couple of episodes on being a woman in medicine. And so I'm not surprised that 1 in 3 female physicians has experienced gender-based discrimination. With that said, I feel that number is underreported as well. What do you think?
Exactly. Yeah, I agree with you. I think it's more than that. And again, it's not just gender-based discrimination. It's a lot more than that, with women. And we addressed a lot of this in our Women in Medicine podcast.
Right. And so being mistreated in your workplace increases the risk of medical errors, diminished psychological well-being, physician suicide, and we'll talk about all of those things. And it also ultimately affects patient care, which is why we're all here. We're all here to take care of people. And how can you take care of people if you can't take care of yourself? And I think that leads to a lot of moral injury. As we say, physicians feel like why they got into medicine is not aligning with the current state of healthcare right now. We have a very high rate of burnout and workplace abuse than other corporate jobs. So why does toxicity persist in healthcare? What are some of the issues that lead to toxicity? And that's what we'll talk about in today's episode.
And I wanted to go back to what you said about the medical errors. I mean, this is key. That's why Patients need to hear about this podcast. Physicians and healthcare workers need to hear about this podcast. Hospital administratives need to hear about this podcast, because medical errors are a big issue when physicians or providers are, having a workplace that is toxic. So it's really just, it's not just the feelings that they have, it's how it's reflected in their work. And that's why it's important to address these issues and talk about it, because it affects the whole, the whole community.
Yes, I agree. And, not to say anything bad about any other work condition, but our job is not a 9 to 5. You come in, you do your desk job, and you go home. When we're affected negatively, there's a lot of repercussions down the line. And ultimately, it's the patient that gets hurt. Um, and patients already don't have a lot of, I'm not going to say respect, but they don't have a lot of faith in the healthcare system. And I can understand that. I'm a patient myself. So when these workplace abuses persist, the patients end up suffering, and it cycles back in a vicious cycle back to us as healthcare workers and healthcare providers. And then now you're just continuing this vicious cycle.
I think this goes back to the saying of, happy wife, happy life. I think we can say happy physician or happy provider, happy patient.
But one thing that has always been the case in terms of medicine, even when I was a pre-med, is there's the mindset that this is just the culture. Like, this is just the way it's always been. And because of that, there's always been some kind of retaliation for speaking up. I think I've seen it happen to my colleagues. I've seen it happen to myself. There's always retaliation for speaking up because this is how it's always been. And there's also a hierarchical structure, right? You have power imbalances. You have power imbalances between students and trainees, and then trainees and the attendings and administrators. So that structure, I think, leads to a lot of power imbalance. And people who are on lower ends of that totem pole, I think, get the most mistreated, and they can't even speak up because, again, there's this fear of retaliation.
And it's interesting because, you know, I feel like those problems, that hierarchy structure, kind of shapes some of the personalities as well. It's just, when you are put in that situation as a medical student early in your training, it kind of shapes your personality to become a person who doesn't speak up, who is an introvert, who is always kind of putting their head down and not, and minding their own business, which is not what we want, which is actually, this is what, that's why the power struggle exists, because those who are in higher in higher ups, they want that. They want to have all the control. They want you to, feel isolated, and they don't want you to talk to each other. So that's why we really have to educate our medical students, starting even from medical schools, that to speak up.
Exactly. And when you have someone who is going into medicine or healthcare, you want someone who's got ingenuity, who's thinking outside the box. However, I think a lot of this, and you might start off that way, but I think the way the system is set up, the way the training programs are set up, they almost like beat that out of you. I don't know if that makes sense, but even if you are a bright person who's thinking outside the box, who has ideas, it's almost like they try to dim that light. You're supposed to put your head down, you're supposed to work. And you see that even in pre-med. Like, I remember when I was a pre-med, our college, or my college experience, was, I think, a lot more challenging for me compared to a lot of my peers who were not pre-med. There was all the pre-med classes were very cutthroat. The environment was very challenging. There's a lot of gunner mentality, right? Like, I have to be better than the other person. Not a lot of teamwork, a lot of fear of failure. And, there's a stigma around seeking help because a lot of people I knew who were pre med, including myself, had this intense fear of failure, like you have to do good, you have to get into med school. And because of that mentality, you kind of isolate yourself. You try to you don't make friends quite as much because you're so focused on trying to be better than everyone else. And I think that does affect your mental health even early on. And there's a stigma around seeking help when that happens. Not everyone's mental health is affected, but I know for me personally, it was very difficult going through the pre-med process because there's so much pressure on you. And then you have to take the dang MCAT, which I think is just an awful measure of anyone's intelligence. So I think even as a pre-med, it's kind of indoctrinated into you that you have to be better than everyone else.
Yeah, I mean, it's just the MCAT was a kind of a horror story. And the other part is that being a pre-med itself is very stressful, as you said, because you have to exceed basically all expectation. And you have to not only you have to perform well in the education setting, but you have to also have a lot of other extracurricular activities that you excel at. I mean, how do you have the time to do that? To do all of this at the same time, it's just very difficult. And then you have to, be kind of humble, and that's kind of normalized. You can't really be too outspoken, about issues. And you have to be careful what you say. Be cautious of what you say.
The issue also is cultural. Like I'm Indian, you're Iranian. Even before we hit pre-med in high school, I would argue even earlier sometimes, it's honed into us that you're going to go, if you want to be pre-med, you have to do XYZ. You have to have all of these extracurriculars. You have to get into the best college. And then once you get to college, again, you have to do all of these extracurriculars. You have to be valedictorian. You have to, set yourself apart and be better than everyone else. So that gunner mentality is there even early on.
The extracurricular is an interesting subject because you should have extracurricular, like you should know music or you should know, arts or anything, but don't be very good at it because you don't want to change. You don't want too much distraction from the studying. So I remember when I expressed interest in the guitar, and of course my parents were like, nope, you have to focus on your studies. Your guitar is not for you, and you really have to focus because you're going to become a doctor. So this is a very kind of, sometimes I feel that that was not the appropriate way to do it.
Even me, I really enjoyed reading and writing. So I was thinking of doing like an English minor, and my dad was like, "It's not gonna." Why? He's like, "Why would you minor in a language yours?" But that's neither here. I mean, honestly, I think I do have friends who went to med school and they were not bachelors of science, right? They were bachelor of arts. So they did it like an arts major, but did all the prerequisites. I think that was actually a very smart way for them to go because their GPAs were amazing. And because of that, they even did better on the MCAT because they had the arts background to be able to decipher all of those vignettes. So who knows, and I think that helped them out.
I had friends who did biomedical engineering, and I think it's good because after they finished their college, then they had the option of working and gaining good money, because they were already engineers. But when I was done, and I took 1 year off because I wasn't getting into medical school right away. That 1 year I was getting paid $13 an hour, with a college degree. But my other counterparts who finished their college with a biomedical engineering degree, they were getting paid much more than that, and then they were able to go to medical school afterwards too, no problem. So I think this notion of you have to have a Bachelor of Science, and it's not the right way to do it.
Once you have gone through all that, there's the med school applications. I feel like I have suppressed those memories because they were so traumatic. Applying to all of these schools, getting rejected, right? Because we've spoken about how you and I both struggled with the MCAT. So you pay all of this money because it's not just one application, it's multiple applications. You have to do secondary applications. You have to fill out the same thing over and over again. And oh my God, it's getting into med school in and of itself is, I think, a nightmare process. I think it continues to get worse. But because it's so competitive to get into med school, I think even going into medical school, you have this mindset of you have to be the best of the best. And I think people who go into med school continue that mindset now into residency training and even attending ship. And I think that's why a lot of physicians, even after they're done, continue to maintain that isolation, like they're better than everyone else. And we see a lot of those types of personalities in medicine.
Right. I mean, you mentioned the interview, the application process, but also the interview. I mean, you spend so much
Oh
money to go
yeah,
on different interviews in multiple states, somewhere that you don't have family support. You basically agree to whatever, it's the process of putting things on the table. It starts then, that you just
hmm
kind of don't value yourself, don't value your priorities. Even if it's a somewhere far away you would be willing to go just to get
exactly.
into medical school.
Yep. And it continues. And when we talk about residency and applying for residency, we'll see that this continues, this act of just putting everything out there instead of expecting something back. Just any job, I'll take it, give it to me.
Yeah,
And
the
then
sacrifices of kind of really personal well-being.
exactly, like your needs don't matter. This is what we're going to give you. You have to take it. If you don't want to take it, then good luck. You're already in so much debt. What else are you going to do with your life? Um, so, that unfortunately happens. And then once you do finally get into medical school, I think there's also another hierarchy there between, or at least in my med school, there was a hierarchy between the older students and the younger students. Um, there were a lot of TAs holding classes and sessions where you could attend just to learn things even more in addition to the lecture to prepare for exams. The pimping culture for me started there, when like some of the older TAs would try to pimp the younger people to try to get them to, learn the topic. I don't know if your school had TAs and those kinds of things, but I think the pimping culture for me started around that time. And I felt sometimes even on the faculty end, this was seen and it almost felt abusive to a certain way, but I know that's not the case in every medical school.
I didn't have that experience in my medical school, but definitely, it wasn't, I mean, so I didn't feel as stressed, but I've heard a lot of medical schools that is a stressful environment, um, especially during the third and fourth year rotations. There are situations that when you start going to even other hospitals that are not within your hospital system, and then you have to compete against kind of other students from other medical schools. That process, it could be much more stressful.
I think definitely the pimping culture and like using humiliation as a learning tool per se is something that you see in what do they call it? Third and fourth electives when you do your
Yeah.
learning electives, even away electives, like your surgical elective. For me, my surgical elective, my OB-GYN elective, all of those electives where they sometimes don't treat medical students well. I think it's now changing where the younger generation of doctors is nicer to the medical students. But even as a medical student, I a lot of the times I didn't know my place. I didn't know what was expected of me. A lot of the faculty sometimes would, pimp us out and ask us questions. And if the audience is listening and doesn't know what pimping, it's basically asking questions, putting you on the spot, asking you questions. Sometimes the questions don't have a right answer. Sometimes the questions are really, really vague. And the thought is it's almost it's almost to bring attention to you and in a sense humiliate you to learn the answer. I don't know if I'm describing that correctly, but have you had any experiences with that, Shala?
I didn't, but I have a story from a friend who was doing their general surgery
Hmm.
rotation, and they were basically it was doing during a appendectomy or something like that, and they were basically the camera holder, you know, so they were
Hmm.
holding the camera, and but they were not holding it correctly. So then the surgeon told them multiple times that, hey, you know, put it this angle or put it in that angle or direct it this way or direct it that way. But after two, three times, he said, if you don't hold it right, I'll punch you in the face. So basically, I mean, yeah, everyone laughed about it, but if you think about
Yeah.
it, it is humiliation, right?
It's
So that was the
abusive
story.
language.
Yeah, yeah, it is abusive language. But of course, what would they do? I mean, they're not gonna. Most medical students don't even complain about it because then they risk their, honors degree, right? If they don't get honors from the attendings, then they risk
Hmm.
going into good residency. So they cannot piss off the the surgeon or any attending. I did have a story of myself that during OBGYN, for some reason, during OBGYN, I had a lot of problems. Um, and there was this particular attending that every time I presented a case to him, even though I did it really nicely, even sometimes better than the resident, he just, for some reason, after I finish, he just looks towards the resident, who was a male resident, and tells them, okay, tell me about the patient. As of like, I didn't even
Oh,
say anything. So that was one time. And then it's interesting because the resident apologizes to me later and tells me it's not you, it's just them. So yeah, there are stories like that out there.
yeah. I think the med students end up being everyone's punching bag, man. It's not fair. I feel really well now that I'm an attending. I do feel bad when I think about those times that attendings did not treat me well, or the times I've observed my attendings be mean to med students as a resident. And I don't know what it is. I think, it's a lot of punching down. You're annoyed with your day to day, so you're like, who can I take this out on? And you take it out on your trainees, and you take it out on med students who are the bottom of the totem pole. And like you said, you're getting evaluated, so no matter how much you're treated poorly, you just have to sit there and take it. And I think that also is one of the beginnings of learned helplessness, where you're like, I can't do anything, I can't speak up, so I'm just going to sit here and take it. And that attitude follows you through training. And sometimes, even when you become an attending, once you get to an attending, some people like myself, you're like, screw it, now I'm going to speak my mind. But when you've been treated like that for 8, 9, 10 years, once you become an attending, you kind of develop this personality of I'm just going to put my head down and work,
Mhm.
and stay out of trouble.
Yeah, and I was gonna say, I mean, there are other problems such as kind of racism and sexism and discrimination that also exist even in medical education. Um, the bias, I think there is some bias towards women, even as medical students. There is lack of diversity.
We spoke about in a prior episode that there's such a high barrier to entry, even because for you to even get started in this medical school process, right, you have to have you have to have money to study for the MCATs, to do all these applications, to fly out to interviews. And because of that, the barrier to entry is high. So you're going to have not a lot of people from lower socioeconomic classes. You're not going to have a high diversity. Sometimes you're not going to have a highly represented student population. Uh, Black students, Hispanic students are very underrepresented. And when you're underrepresented, I feel like you're treated even worse in some of these situations. So it actually, I think, is a very sad situation to be in as a student, because not only are you underrepresented and you don't see people like you around, but now you're a target even more, for some attendings, for some residents. And who do you turn to for help?
Yeah, and then some of those financial barriers lead to more depression because you have to see. I mean, if you have financial barriers and you can't go out a lot, you can't travel, you have to watch, what you're spending, um, and then on top of that, you have to study really hard. So
Hmm.
you see a lot of depression. Actually, globally, approximately 27% of medical students experience depression or some sort of depressive syndrome or symptoms. So this is a very high rate compared to
Yeah.
non-medical peers.
There's a sacrifice of personal well-being even this early on. There's unrealistic expectations of your time and effort. You're sleep deprived, right? Because even as a med student, sometimes you have to study. You have to go to rotations. Some of my subspecialty rotations expected that I do call, but I still had to study for the boards. USMLE, you have to study for your shelf exams. So you're sleep deprived. You have poor nutrition. You are very, very stressed out. Like you said, because you're financially limited, you can't really do anything fun. You can't travel. You can't, go out with your friends. Or even if you can, it's very limited. Depending on where you are, you're also isolated from friends, family, and support. And then again, there's the financial pressures and the student debt stress. So overall, get used to the sacrifice of personal well-being. And this is something that is introduced to you even as a pre-med, even as a med student. And now you're going to take this into you or into training with you. And that's what we'll talk about in our next episode.
Yeah, it sets the tone for your next 10 years of life, right? Which is, I mean, not particularly a good one, but we don't realize it until later in life. The trauma really doesn't resurface until later in life. And if you don't take it, I mean, you're considered a failure, right? But I think nowadays, a lot of people are coming to this realization because I came across a few podcasts from physicians who dropped out of their medical training and became entrepreneurs, and they're going on podcasts, they're talking. Maybe we can invite one of them here on our podcast. But it's interesting because now more people are talking about this, that it's okay if you drop out. It's okay, you go to consulting, you go to education, you go to other fields or become an entrepreneur, and it's okay to do that.
You definitely are having this generation is speaking up more, and hopefully that will continue to change. They're also unionizing now. And we'll talk about that in the residency section, like the next episode. But yes, I think people are finding their voice, and I am very happy to see it because for the longest time it was like this is how it's going to be. You can take it or leave it, but if you leave it, where else can you go? And we'll talk more about the toxicity of medicine when it comes to medical training, residency, and fellowship.
Yeah, and then afterwards the attending life. So it
It's
continues.
never
There's a lot to
ending.
talk about. Yeah, there's a lot to talk about, and then we'll stay tuned because we will also talk about solutions of workplace toxicity. Thanks for tuning in to the Be Empowered podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and rate this podcast. Share it with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.